So you can just do the stimulation on these 8 points and you can make the stronger immune system. The first point is Bilangu Marma. So this is the location of Bilangu Marma, and Bilangu Marma has been considered as an alarm point of lung. बिलांगू मर्मा को लंग का अलार्म पॉइंट कहा जाता है। तो जब भी हमें अगर अपना इम्यून सिस्टम स्ट्रांग बना के रखना है तो बिलांगू मर्मा को ट्रीटमेंट देना होगा। अगर आपके शरीर में कोई थोड़ा बहुत इन्फेक्शन ऑलरेडी इंटर कर गया है तो आपको बिलांगू मर्मा पे दर्द भी मिलेगा। So if you are doing the stimulation on the bilangu marma and feeling the pain sensation, it's so there is some lung infection, either there is some lung infection or something is started, initiated in the respiratory tract. तो हमारा ये जो कॉलर बोन होता है, this is the collar bone. If from the collar bone we go on the lateral side, so let's see this image. अगर हम इस इमेज को देखें, so we can see the collarbone. This is the collarbone. अगर collarbone, if we divide the collarbone in 3 parts, तो सेकेंड और थर्ड पार्ट के नीचे ये जो हमें एक डिच मिलता है, so we, this is the बिलांगू मर्मा. अगर आप कॉलर बोन को देखें, look at me, I will show you. So look at this collarbone. Collarbone is starting from this point, then it is going like this. This is the collarbone. So if collarbone is this much long, so we can divide in 3 parts, 1/3, 1/3 and 1/3. Lateral 1/3 के नीचे we will feel this pit or depression. This is called bilangu marma, and this is also called the alarm point of the lung. So first point, we have to stimulate this bilangu marma for improving the immunity of lung. तो हमें बस इस पर अपना फिंगर रोटेट करना है clockwise and anti-clockwise. So we can rotate the finger here clockwise and anti-clockwise. Then we can do the other side. So this will be the first marma to improve the lung immunity. अगर इसमें दर्द है तो समझ जाइए कि कहीं ना कहीं थोड़ा लंग में कुछ ना कुछ इन्फेक्शन की शुरुआत हुई है. So this will be the first point, बिलांगू मर्मा. जो the second point जो आएगा, जो हमें lungs को immediately immunity provide करेगा, the second point for making our immune system is very stronger, which we never can forget, that is Adappa KALAM. Adappa. The location of Adappa KALAM I will show you once again in the image. You can see the location of Adappa KALAM in the image. It is near about 13 finger away from the nipple on the side, or we can see in the mid-axillary line. So we can see here how we measure. Look at here. तो हम कैसे मेजर करते हैं अडप्पा कालम को? निपल लाइन से अगर हम निपल से अगर हम ऐसे हाथ को रखें, if we keep our hand like that, if we keep the thumb on the nipple and go like that, So this is the location of Adappa column in the mid axillary line. So we have to stimulate this Adappa column for better immunity. One, so we can do the some stimulation like that for 10 to 12 seconds. Then we have to do up and down. And we can do other side also. So we can do the forward backward movement, and also we can do the horizontal movement. So these are the 2 points. Now, out of 8 points, we have seen the 2 points. Now I will show you the point number 3 and 4. So let's first see the image. So we can see the image here. This is the navel. Or on the navel, we are having Manipur chakra, or we can tell navel only. So this navel is called Anna kalam. Anna kalam. Because this is the place of Anna, or this is the place of grains. So the name of this marma point is Anna kalam. First, you see how we can stimulate this point. So this is the location of Anna kalam, navel region. So I will keep my middle finger here. You can see, I will keep this part on the navel. And I will keep my one finger up and down. And after that, I will do little gap in my all the 3 fingers. This gap will be near 1 finger gap. So in this way, I will keep my 3 finger here. Between every finger, I am having 1 finger gap. Then I will not do anything with this hand. बस ऐसे 3 उंगलियां रखकर मैं इस हाथ से कुछ भी नहीं करूंगा जो मेरा हाथ रखा हुआ है. Now I will keep my other hand over this hand. Now from this hand, I will do press and release, press and release. Look at here. Press, release, press, release, press, release. So this is called Anna kalam stimulation. This is the center finger, this is the upper finger, and this is the lower finger. So in this way, I have stimulated the upper point. I have stimulated the center point, and I have stimulated the lower point. So this is the stimulation of Anna kalam, which is very effective point. We'll see the benefit of this point. Now from this point, if we go 6 finger down, 4 and 2. So this is a 6 finger down. This is the location of Swadhisthana chakra, or in the Marma Shastra, we are telling it KALIDAI kalam. Now we have to stimulate this point. And how to stimulate? Let's see. I will keep my this wrist part on the navel, and I will make this image. I will keep my wrist on the navel, and I will touch this KALIDAI kalam. Now I will do like this. I will do like this. This is called adangal application. This is called adangal. I am keeping my wrist here. I am keeping my other finger on the navel, below the navel, on the Kalidai column. Then I am squeezing like that. Look at it. I am doing from one finger so you can see like that. Now I am doing with all finger. So this is the navel. I will keep one finger on the navel, one finger over the navel, means one finger up and one finger down. I will keep the three finger there. तीन उंगलियों को यहाँ पर रखा और इनको दबाया बस. We have done the press and release. That's it. So we have to do the only 10 to 12 seconds. So when we are doing with the help of three finger, in the Ayurveda it is mentioned the center point is good for Saman Vayu. Saman Vayu reside in the stomach and improve the digestion. Upper point good for Udan Vayu. Udan Vayu is good, then the function of Udan Vayu is lifting the energy up. And the lower point is rectifying the Apan Vayu. If Apan Vayu good, then you will not suffer with the constipation. So let's see once again. There are three fingers. This is the navel region. The center finger is good for Saman Vayu. Saman Vayu is good for digestion because the place of Saman Vayu is stomach. So it is good for digestion. The finger which is down is correct Apan Vayu. Apan Vayu is responsible for stool and urine expel function. So Apan Vayu is good, then you will not suffer with the constipation. So it is connected with the evacuation. If this is wrong, then you will suffer with the constipation. And upper finger is connected with the Udana Vayu. Udana Vayu. If Udana Vayu is not good, then there will be lots of cough formation in the body. So when we are stimulating with the help of these three fingers, this is called KALAM stimulation. KALAM stimulation. And after that, we are going on the next MARMA point, that is KALIDAI KALAM. This MARMA point is 6 finger down from the navel. 6 finger down. Or we can correlate this with the Swadhisthana chakra. And this has been proven. If your Swadhisthana chakra is good, then you will not suffer with the lung disease. Now you will ask, what is the connection with Swadhisthana chakra and lung disease? Let's see here. In the human body, we are having multiple chakras. This is the throat chakra. This is the heart chakra. This is the third eye chakra. Here we are having solar plexus. Then we are having navel chakra. Then sex chakra or Swadhisthana chakra. Then Mooladhara chakra or root chakra. So we are having mainly 3 chakra up and 3 chakra down. This is third eye, throat, heart. This is navel, sex chakra and root chakra. The sex chakra is called KALIDAI KALAM. So now, when we see the relationship of the chakras, these chakra make the internal circuit and they are connected with each other. If something wrong with the navel chakra, it will create the problem with the heart chakra. If something wrong with the heart chakra, it will create the problem in the navel chakra. अगर किसी को हार्ट की प्रॉब्लम है, आप नेवल को ट्रीटमेंट दोगे तो हार्ट ठीक हो जाएगा. In the same way, this is the second relationship. This is called middle circle. The throat chakra and sex chakra is interconnected, and this is the third circle, third eye and root chakra is interconnected. So we are having 3 circles: inner circle, middle circle, and outer circle. If you want to rectify anything connected with the throat chakra and anything which is connected with the lungs, then you can rectify with the sex chakra. The Bij mantra of sex chakra is Bum. Bum. So that's why the who chant bum 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 bole bum bum bole. The bum is the mantra of Swadhisthana chakra or KALIDAI KALAM. So the bum mantra is very excellent for sex chakra as well as cough and cold, because it is directly influencing your throat chakra. Throat chakra is connected with the lung. The Bij mantra of KALIDAI KALAM or Bij mantra of sex chakra is Bum. So this is the 3 circle relationship we can see here. So this is stimulation. When we pull the KALIDAI KALAM toward the navel chakra, this is called Adangal application, and this is very much effective in the MARMA Shastra for lung disorder. So in this way, we have seen the first point we have to stimulate, that is Bilangu Marma. The second point we have to stimulate, that is Adappa Kalam. The third point we have to stimulate the Anna Kalam on the navel region. And the fourth point we have to stimulate the KALIDAI KALAM 6 finger blow. And even we can chant the Bum mantra for this, because this is the highly effective chakras to rectify the throat problem. And after that, the next step. This is the very excellent MARMA point to prevent if some attack already happened. अगर आपके शरीर में वायरस इंटर कर गया है, Now, if you want to expel it out, इसको बाहर आप निकालना चाहते हैं, तो chimil irupu, this is the excellent murmur point. This found over the mastoid bone. Where is mastoid bone? This is the mastoid bone. So let's see chimil irupu. So you can see this image. If you go on the back side, then you will find the mastoid bone here. यहाँ पर mastoid bone मिलेगी हमको. This is the mastoid bone. Mastoid bone. And this place is called chimil irupu. This is the great murmur point to expel the infection. And how to stimulate this point? Whenever we want to stimulate this point, there is a special technique. We have to keep our 3 finger here. 1, 2, and 3. And here we will feel one pit. This is the mastoid bone. All of you can feel, all of you can rub your finger on the back side of the ear, and you can feel here mastoid bone. Now keep your 3 finger there and just do the rubbing here. Just do the rubbing. Just do the rubbing. This area is very excellent to expel the infection out. Just we have to keep our 3 finger there and we have to do the rubbing like that. Now, we have to do 2 types of stimulation here. हमें इस पॉइंट को 2 तरह से स्टिमुलेट करना है. पहला रबिंग करना है और दूसरा रबिंग नहीं करना, सिर्फ मूव करना है स्किन को. So we have to stimulate in 2 ways. Number 1, keep your 3 finger here and do the rubbing up and down minimum for 10 to 12 seconds. And after that, just you keep your finger on the bone and move the skin. See, moving the skin like that. Moving the mastoid bone up and down. Moving the mastoid bone up and down. So we have to do 2 types of stimulation. First rubbing, then moving the mastoid bone up and down. So every one of us, we know the name of this point is Sara Mudichu. The meaning of Sara Mudichu, the junction of cervical 7 and T1. So we have to stimulate the 2 points. One the Sara Mudichu and one the 2 finger both the side from the Sara Mudichu. Because this whole area is creating the defense system. So like suppose someone is suffering with a fever, then these points are very excellent. These points are very excellent if someone is suffering with a fever. So how to stimulate them? We know the Sara Mudichu, just we are doing the clockwise. So we will keep our 1 finger there. We will keep our whole palm there and we'll do the rotational movement like that. Okay, in this way. So this center is the Sara Mudichu. Now we go 2 finger both the side. This point. This is the next MARMA point. So we have to do the press and release. Press, release, press, release, press, release, press, release, press, release. So this was the stimulation of these 2 points. So center point, the Sara Mudichu, we have to do the clockwise and anti-clockwise movement, which is very good for improving the defense system and also reducing the fever. In the acupuncture, if we put the needle here, so if someone is suffering with a cough and cold and fever, the same point is reducing the fever very fast. In the MARMA also, we are stimulating this point for reducing the fever. So the center point is called Sara Mudichu. And the point both the side, two finger both the side, that is called KILIMEGA MARMA. KILIMEGA MARMA. In the acupuncture, the center point and the both side point, two finger both the side, these all the point has been already mentioned. But in the MARMA also we see these points for improving the defense system and for reducing the fever. The center point is Sara Mudichu, and the point both the side, two finger on the both the side, that is KILIMEGA. Let's see in this image. If we see this image, so this is the center point where neck is ending. This is Sara Mudichu. We already know, we already discussed. Now from the Sara Mudichu, we are going two finger on the right side, two finger on the left side. That is called KILIMEGA. KILIMEGA MARMA. In the acupuncture, we are telling it UV11. And the acupuncture Sara Mudichu is called DU14. And DU14 is the great point for improving the immunity. DU14 पर हम point लगाते हैं तो fever उतर जाता है. अगर किसी को cough and cold and fever हो तो DU14 से उतर जाता है. So we have already stimulated these 3 points now. Now let's proceed for the next point. This is the KHHIPRA. KHHIPRA is the storehouse of enormous energy as per the MARMA Shastra. Because if someone is suffering with any viral infection, he suffers with the fatigue. So we can increase the lots of energy with the help of this KHHIPRA. And how to stimulate this point, we know. Let's see the stimulation of KHHIPRA. So we are keeping our, this is the attachment of ear. This is the attachment of ear. So just we are touching, then pressing little, lifting up, then doing clockwise rotational movement and anti-clockwise rotational movement. So we can do little fast also because touching, lifting, and do the movement. So this KHHIPRA we have already seen, and all of us already know this KHHIPRA because we have already discussed. This is at the attachment of ear, and this point is connected with the kidney, and kidney is having the storehouse of energy. That's why this point is called the storehouse of energy. So if someone is suffering with a fatigue, you can increase the energy. Just you touch this point and sit for 1 minute. You will feel the good sense of energy in your body. The last point, and very much important point. The last and very much important point, that is KHHIPRA MARMA. So Chipra marma, this is the hand Chipra marma. We can see the muscle here. This is the interosseous muscle, and do like this. We can see the protruding muscle and the center point of the protrusion. I will show you again. And in the other image, we can see the. So these are the Chipra marmas. Both are the Chipra marma. In the legs, we are also telling it Viruddhi KALAM. Chipra marma, Viruddhi KALAM. So we have to stimulate these points at last. Let's see how to stimulate. So we can see this is the muscle. If we unite all the fingers, सभी उंगलियों को मिला दें, तो यहाँ पर जो उभरी हुई मसल दिख रही है, इसका जो सेंटर है, ये विरुद्धि का, ये चिप्र मर्मा है. तो हम इसको बस अपने अंगूठे के इस जॉइंट से, अंगूठे के इस जॉइंट से, from this joint, we keep in the center, and just we press and release, press and release, press and release. So we are pressing this point. So we are pressing this point. Press and release, press and release, press and release. So this is the point. This is called Chipra marma, the center of this muscle. So we are not touching the bone. We are not touching the this side bone, just we are in the center of this muscle. Now let's see the Viruddhi KALAM. If we fold the legs in this way, so we can see the knuckle here. This is the knuckle and this is also knuckle. In these two knuckles, this is the depression. So this depression is called Viruddhi KALAM or Chipra marma. So we can press and release here, press and release. So we can do press and release, press and release, press and release. So we are pressing this point in between the knuckle. And look at my hands. This is the point. So we are pressing this. These points already has been used by many marma asanas. Yeah. When we talk about the foregate now, in the foregate, Li4 and liver 3 we stimulate. But in the marma, we are taking Li4, but liver 2. As per the marma, the location of liver 2 is more effective. So we have to do both hand and both feet. So first we started our journey with the Bilangu marma, then Adappa KALAM, then in the abdomen Anna KALAM, and 6 finger below, that is KALIDAI. So the Bilangu, Adappa, and one on the navel and 1 6 finger down, that is KALIDAI. After that we went to the back side. After that we came to the here for expelling the pathogen out, that is over the mastoid or chimil, Irappu. Then we went to the back side, Sara Mudichu, and both the side of Sara Mudichu, that is KILIMEGA. Then Poigai KALAM. And finally, Chipra marma. So let's see quick. This Bilango Marma is directly connected with the lungs and it is called the alarm point of lung and improving the immunity of the lung. So this is the first point. So we are improving the lung function with the help of Bilango Marma. We are improving the vital capacity of the lung. Second, Adappa Kalam. With the help of Adappa Kalam, we are stopping the phlegm formation. Phlegm formation. So if we stimulate the Adappa column, we are not allowing to form the phlegm. So first point is improving the lung. Second point is avoiding the phlegm formation. Third point improving our digestion and as well as expelling the stool out. So no constipation. And our Shaman Vayu, Udan Vayu and Apan Vayu will be good. The next point is Kalidai column. The Kalidai column is directly improving our throat chakra because of the chakras relationship. When sex chakra is weak, then person is suffering with the frequent throat infections. So we are improving the Kalidai column or Swadhisthana chakra. Then Chimil Iruppu is expelling this is the next marma point, the Chimil Iruppu. The Chimil Iruppu sound over the mastoid bone. So Chimil Iruppu will throw out expel the pathogen out. Sara Mudichu will improve the immunity and reduce the fever. Poigai column will increase the energy level, and this is connected with the kidney, and kidney is responsible for deeper breathing. So this is very helpful. This is the very excellent point for expelling all types of infection out. KHHIPRA marma. So in this way, we can see here, we have stimulated the lung point. We have stimulated the spleen point. We have stimulated the stomach point. We have stimulated the chakras. We have stimulated the gallbladder, which is expelling the wind out. We have stimulated the DU meridian, which is improving our immunity. And we have stimulated this kidney point, which is responsible for deeper breathing. And also we have stimulated as per the acupuncture, LI4 and liver 2. So with the combination of this, either you think as per the acupuncture or as per the Marma Shastra, with the combination of these all points, we can increase our immunity in very greater level. So the Bilangu Marma is very good for lung. Adappa Kalam is very good for phlegm. Anna Kalam is very good for digestion. Kalidai Kalam is improving the throat chakra. Chimil Iruppu is good for expelling the pathogen out. Sara Mudichu is improving the immunity. Poigai Kalam improving the fatigue. And hand and feet chakra is responsible for infection, reducing the infection. And so how many points we have covered? So we have covered all the points. So in this way, if we stimulate these points, definitely we have to do all the points every day. Even if someone is suffering with the infection, if he start immediately, then these points are going to work very nicely for the patient. Now, we should also do one more thing. In the Ayurveda, it is mentioned. Now, this is the last which I am going to tell you right now. In the Ayurveda, it is mentioned the Nashya Karma. So, as per the Ayurveda, if we want to keep away all the respiratory infection, then we should do the Nashya Karma. The meaning of Nashya Karma, putting some medicines in the nostrils. So there are many medicine which is recommended in the Ayurveda, but two medicine, they are very easily available everywhere. And everyone can apply. The medicine number one is Anu Tel, Anu oil. Just 2 drops in the nostrils. So do the gentle massage over the face and around the nostril. And put 2 drops of Anu Tel, Anu oil in your nostril, both the nostril. And when you put, just lean your head little on the back side and put the 2 drops of Anu Tel. Or if it is not available, then just you can put the cow ghee. In Ayurveda, it is mentioned, if you just want to put the 2 drops, then there is a no rule, you can do anytime. But when this amount is increasing, 10 drops, 15 drops, 20 drops, which should do only under the Ayurveda physician. That time there are certain rules and regulations that in which condition we should do and in which condition we should not do. But putting the 2 drops is very safe and there is no rule for this. You can do anytime. Just don't do just after taking the meal. That is the recommendation. So this is called Nashya Karma. The Nashya Karma is the excellent karma to remove the blockages from the nose and to improve the respiratory health. So this is the completion of topic. If you have any question, you can ask me.